Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today, we're excited to welcome Helen Duyvestyn, a registered nurse and life coach from New Zealand. Helen has spent over 15 years on the front lines of psychiatric care. 10 years ago, she had a powerful realization. The conventional treatment for mental health disorders is often limited and disempowering. This led Helen to explore new approaches to mental well-being. Now, as the founder of One Life, Helen focuses on a holistic approach that integrates the 3 pillars of mental health: food, sleep, and movement. In this episode, Helen shares her journey, the research on how food impacts mental health, and why the medical model of treatment needs to change. Helen, welcome to the show.
Thank you so much, Audrey. It's a pleasure to be here.
Yeah, absolutely. And you're joining me from across the world in New Zealand.
Yes, we live in a little town by the coast, actually. So we're very lucky. We've moved down here from Auckland City 2 years ago, yesterday, actually. It was our 2-year anniversary living here. So yeah, quite a different space from you.
Well, I appreciate you taking the time to chat with me today. We can go ahead and kind of dive into your career. You worked in psychiatry for a long time. And I know that there was kind of one day where you just kind of had it. So why don't you tell us a little bit about how you got there?
Yeah, fantastic. So I worked in frontline mainstream psychiatry in South Auckland for a number of years, at least 15. I'd worked in general nursing for a few years before I went into psychiatry. I was what they called a crisis team nurse, so a community crisis team nurse. We would go out to people in acute psychiatric illness states. I was what they called a dual authorised officer, so I helped to use the Mental Health Act for people to admit them into psychiatric units. And then later on in my career, I went into one of the biggest hospitals in New Zealand, and we were the frontline sort of psychiatric services that assessed everybody that came in through the hospital that needed psychiatric attention. So this was a lot of acute distress, self-harm and very much frontline work. And I actually really enjoyed the job as much as you can enjoy such a challenging job. And I had an amazing team of staff around me, very small team, but really cohesive, lovely bunch of people that I worked with. And I noticed actually over a couple of months that I was starting to feel a little bit sort of despondent, but I didn't really know what that was all about. And one Monday morning, I went into work. Every morning we would go through the names on the board of who had come in over the night before. And so, it would be people that had come in with self-harm or a suicide attempt. We'd read their stories, why have they come in? What's their psychiatric background? What was their treatment plan? What were we going to do? So the Monday morning, no different than any other morning. And I sat there listening to the names and their stories. And I just thought, I've heard these stories so many times before. And actually, a lot of these names I have heard so many times before. We think of them as the revolving door clients, the people that would come in, acutely either mentally unwell or after a self-harm. And we would go down there and we would, maybe readjust their medications. We might pop them into a respite facility for a little while. But they weren't getting better. They weren't really improving. Some of them would get some talk therapy if they were lucky. Some of them would be under sort of more long-term community mental health centres. Some of them, they would just go back to their general practitioner, their doctor, and wouldn't really get much more input than that. And I was sitting there this morning, I was listening to these names and I was listening to these stories, and I just thought, I can't do this anymore. I can't just go down and make some adjustments and hope that they will get the support that they need. It was quite a shock to me, and I actually started to feel quite tearful, and I was like, these people are suffering. These people are suffering, and then nothing's really helping. Nothing that we are doing is helping. And I remember at the time, because I actually started to get quite tearful, and so I stood up and I busied myself in the meeting. I pretended I had to do something in the corner of the room, and I was thinking, oh, what on earth is happening? And so I excused myself. I went to the bathroom and I was like, oh, what is going on? I've been doing this job for 15 years plus. Why all of a sudden now? What is happening? So I thought, oh, I think I need a break. I think I need a bit of a holiday. So I waited for the meeting to finish, and then I knocked on the door of one of the psychiatrists, and we were all very close. We'd been working together for a long time, so we knew each other very well. And she was like, yep, come in. And she sort of looked at my face and she went, oh. And I went, I'm not feeling that good. I said, I think I need a break. And she was like, absolutely, take a break and, take the rest of the day off and go and see. We had employee assistants, people that we could go and see, a counsellor or a psychologist. So I actually booked an appointment for that afternoon. I took the rest of the day off. I went and saw the counsellor, which was another interesting experience. And I thought, okay, I'm going to take the rest of the week off and I'll just see how I feel. So I took the rest of the week off and I went and saw my general practitioner and I had a chat, and I saw the occupational health doctor from the hospital that I was working at. And he said to me, oh, it sounds like you're a bit burnt out. And I went, oh, is this what this is? I really didn't know what was going on. And I was like, oh, okay, well, I just need a couple of weeks off and I'll be fine. And he said to me, in my opinion, he said, it takes about a year to recover. And I was like, oh, don't be ridiculous. This is crazy. I'll be fine. I'll be fine. So, it was so sudden. And I took a few weeks off and I took a month off, and I used up all my annual leave and I used up all the sick leave I'd accumulated over those many years, which was actually quite a lot. And about 3 months afterwards, I thought, I really don't feel I can go back into that environment. I'd lost my resilience around dealing with difficult stories. And I felt quite vulnerable myself. And it was all a bit shocking to me. And I thought, oh, is this what burnout is? I didn't feel depressed. But I didn't want to be around people. I felt like I wanted to isolate, but in a really happy way. Like I was just happy at home and happy in my garden and happy doing these things. But the thought of just hearing more distressing stories, because as you can imagine, some of the stories we would hear would be so challenging. Mm-hmm. And after 3 months, I went back and I asked, unfortunately, we'd had a change of managers during that time. So I went to meet with a person I'd never met before, a completely new manager. And I said, oh, I think I need another 3 or 6 months off, leave without pay. I just need a bit more time. And they said, no, we're not going to do that. And I was like, oh, well, that leaves me no other, I don't know what else to do. So I said, well, that leaves me no other option but to resign. And they were like, oh, no, don't resign. And I was like, well, I don't know what else to do. I didn't feel comfortable making these life-changing decisions about the people I was working with in my current state. So I left. And not only did I leave my job, and I'd been working for this actual company, this what they call a district health board, for 19 years in total. So I left my job. Yeah, it was a long time. And I left nursing completely. Like I actually handed in my nursing registration because I thought, I don't feel comfortable working as a nurse at the moment. It's just too much responsibility. So I thought, oh, what am I going to do? And I just took some time out and I reflected for a little bit. And my daughter was working as a volunteer over in Ghana in Africa. And she said, why don't you come over? And I said, oh, no, I need to stay home and get well and, find another job and figure out what I'm going to do with my life. And then about a week later, I was like, this is ridiculous. Why don't I? Why don't I just go traveling? Why don't I just really take some time out? So I did. And I traveled for about 8 or 9 months. And then I thought, I better think about what I'm going to do. I need to come home at some stage and decide what am I going to do as a nurse and with all this knowledge. And, I trained in dialectical behavior therapy and I'd done some, I'd had so much in my brain and so much knowledge. So I thought, well, what do I love about nursing? What is it that I really enjoy? And I felt I love the people interaction. I love the one-on-one assessments. I enjoy helping to move people mentally in a new direction, give them a bit of hope, help them understand themselves, maybe what's driving some of what's going on. So I love that side of things. And I was thinking, what don't I love about nursing? What are the things I'm really struggling with? And a lot of it really came down to the medical model, that we were just so confined to our treatment models. It was like, oh, well, you're not feeling well. Here is either a medication to help you feel better, or if you're lucky, we'll book you in for some talk therapy. And you may or may not get that within the next 6 weeks, depending on how the capacity really of the people that they're being referred to. So I just thought, there's got to be a better way. There's got to be a better way of approaching how we deal with mentally unwell people. So that led me on a path of discovery, really. I just started to do as much research. When I mean research, I mean Googling and looking for, what helps a person to be mentally well? What helps a person to have resilience? What makes a difference to one person that experiences a depression and recovers, and another person that experiences depression and kind of gets stuck there? What is it that really creates a happy, healthy human? And so I looked and I was doing everything, all the short courses on the internet I could get my hands on. I was looking at, how we build resilience, the science of happiness, every book I could get my hands on happiness and health and like just everything.
Those are big questions you're trying to answer.
They were actually, but amazingly, I thought, gosh, there's a lot written here I had no idea about. There's so much that I had no idea about. And I'm like, oh my goodness, I've been in this profession. I've been in the psychiatric nursing role for all these years. And yet there was so much I didn't know about, because we're so much of a sickness model, an illness model, so we know about schizophrenia and we know the symptoms of depression and we know how to look at a diagnosis in the DSM-4 or, the diagnostic manual that you might use. But we don't actually look a lot about wellness or health or happiness. And so that's where I started to really refocus my attention. I was like, okay, well, I know a lot about sickness and I know a lot about psychiatric illness. What do I know about wellness and well-being and happiness? And what truly makes a difference in creating a healthy human? So that's where I started to put my energies.
Why do you think, I don't know if you have theories on this or not, but why do you think that we don't learn more about that as clinicians, whether that be in our nursing education or on the job training?
I personally don't know. I just think it's old-fashioned medical model, very disease-focused, very illness-focused. I'm curious, what are your thoughts about it?
I don't know. I think that, in medicine, we're very specialized, which can allow us to be very good. I mean, we're experts in the, like, whatever the specialty is, whether that is like you're a surgeon and you operate on like one body system, or if you are like a nurse specialty and you deal with like a specific stage of life. But I do wonder if that sometimes prevents us from seeing our patient as the whole person because we are so focused within our specialty. But yeah, I don't know. And I think that, clinicians like yourself, we're there doing the best that we know how to do. It kind of makes me wonder because you were able to go off and find like all of this additional information with your own searching just by following like your own train of thought and questioning.
Yeah, it was quite eye-opening to me. I was just like, God, I feel like we've got it all wrong. I mean, we do a great job and we, like you say, we're experts in the mental illness side of things, but there's so much more that we could be doing with people. So much more that we could empower them, actually. It was about how can we make these people feel like they've got some say in their healing and they can do something themselves to support them to get well. And I was just, yeah.
And so through all of your own discovery, then you decided, okay, there's a different way to do this and I'm going to do it, basically. And so talk to me about how you decided to kind of make that pivot in your own career and kind of the three pillars of mental well-being that makes up your approach.
Amazingly, I was still overseas when I was doing a lot of this discovery, and I was sitting in Bali, actually. I was sitting there with my laptop many days working away, and I just came to me. I thought, well, why can't I do this? Why can't I develop my own model of mental health care that goes beyond the illness model and actually looks at what can we do? What can this person in front of me do as an individual? What can I support them to do that's going to help improve their mental health and well-being? It was quite stunning that part of the research that I was looking at, so I was looking at research articles and going through PubMed, what helps a person to be well and what supports mental health. And I just kept stumbling across research around nutrition and mental health, like the association between poor diet and poor mental health, the association between having five plus a day or, 3 vegetables and 2 fruit a day and its association with better mental health, like less psychological distress. And I just thought, hang on, not once in my entire career of psychiatry has someone talked to me around how food might be impacting a person's mental health status or affecting their mood. And when we do assessments in psychiatry, we never asked about diet. We would touch on, make sure that they're not drinking too much coffee or energy drinks if they weren't sleeping at night, or, if they had a bipolar disorder and they were a little bit elevated, we might look at that, make sure they're not having too much caffeine. But we did absolutely nothing, no assessment of diet. And so I thought, well, this is kind of amazing. This is something that we've completely missed. And so I came back home to New Zealand and I started to go to conferences, like any conference I could find on alternative ways of dealing with health in general. So I thought, well, I need to go down the general health path because diet's obviously very important for general health. We know that. We're quite okay with understanding that. So I went over to Australia, and one of the first real sort of moments that solidified that I knew what I wanted to do is that I was in Australia when Professor Felice Jacka first released her information on the SMILES trial. So what their trial had done is it was a small trial. It was based in Australia. They had taken a group of 60 7 people who had been diagnosed as being moderately to severely depressed. And they split the group in half, as well as you could split a group in half of 67 people. And they gave half of them a modified Mediterranean diet education. So they just had a dietitian that gave them education on how to eat a modified Mediterranean diet. And the other half had social support for the same length of time. So they would get together with other people, because social support's also been shown to be helpful in people with depressed mood. And what they found is that after 3 months of these people that had had these education sessions, 32% of them were no longer depressed. They no longer fit the criteria for depressive illness. And I remember sitting in this auditorium, hearing this information being presented, and my mouth just kind of dropping. And I was looking around the room and I was like, does anybody else hear this? Like, we could take, the entire nation of depressed people, all the people that are depressed in New Zealand, and we have got an average diet, and I imagine that most of them have an average diet, and we could give them some education and encourage them to change their dietary pattern, and 30% of them-ish would no longer suffer from depression. To me, this is huge. We look at our statistics around suicide rates in this country. We have got some of the highest youth suicide rates in the world in this country, which is odd, I find. I don't think anyone's really got to the bottom of it. And we know that depression is closely associated with suicide. Not always, but we know that it's definitely a contributing factor. So I was like, this is going to change psychiatry. In my mind, sitting in this auditorium, I was like, oh my God, psychiatry, we're going to have dietitians as part of the psychiatric team. We're going to be getting in there, and this is amazing. And of course, as we know, that hasn't happened. But it was one thing that I just thought, this is what I want to do. I really want to bring what is now really considered lifestyle medicine into my practice of mental health. So when I started to look at more research around what else helps, and nutrition is obviously for me something I'm incredibly passionate about. We also know that movement, so exercise, has been shown to be as equal as an antidepressant in many studies. So we know that movement is very important for mental well-being. And we also know from looking at the research that I was looking about sleep, poor sleep pattern almost predicts a poorer mental health pattern a couple of years down the track. So we know that people that have poorer sleep pattern are much more likely to develop a mental illness. And we know that if a person is mentally not well for whatever reason, and they improve their sleep alone, they don't treat the mental illness as such, they just improve their sleep, they will have a reduction in their symptoms and their mental health symptoms. So that when I was learning all this, I thought, well, this to me sounds like a model that I can use. And I refer them to the 3 pillars, but I think of them as a triangle. I think of them because it's easy to remember for a person that I'm talking to. Sleep, nutrition, and movement. And even for myself now, if I'm starting to feel a bit flat, or, I notice that my energy is a bit low, I'm not functioning as well as I feel I could, it's something I do for myself. I'm like, what am I missing? Have I been sleeping as well as I could? Am I eating as well as I could? Have I had a few days of not so great eating? And then am I moving enough? Am I actually getting up and getting outside? And I mean, there's all sorts of other positive things we know about being in nature, and sunlight, for example. Vitamin D is very closely associated with mental illness, so low vitamin D levels. So it's something I use for myself, and I find that people find it quite easy to remember as well. Okay, so what am I doing out of these 3 things? Has something kind of fallen off? So that's in some ways the basis for my model. So I decided, right, I'm going to start up my own business. And I started. So the other thing I was really struggling with, I thought, who's going to come and see a mental health nurse? Like, who's going to want to, like, it's not a very sexy thing to go and see. I'm going off to see my mental health nurse. So I thought I needed something else to hang my hat on. What else would people, and I didn't want to, because I thought, oh, maybe I can retrain to be a counsellor and I can embed my model in that. But I thought, oh, that's another year or two of study and training. And when I looked at the counselling, it was like very basic. It was stuff that I'd incorporated anyway, and I'd been doing so much of it. I was like, oh, I don't want to go and get it. This sounds terrible, but I don't want to go and get a certificate in counselling after all these years. So I thought, well, could I train and be a coach, a life coach? Because in those days, health coaches, well, at least in this country, didn't really exist. We didn't have health coaching as a profession. So I thought, well, maybe I can train to be a life coach, because that's kind of something that people are often drawn to. And, they kind of understand what a life coach might do. So I went off and trained to be a life coach. And I thought, right, I can call myself a life coach and a registered nurse. And amazingly, I started my business very slowly. I was doing some part-time research work as well. So I was working for the University of Auckland, doing some part-time work as well as starting up my business. And I actually then ended up being shoulder tapped to come and work in a holistic health company for about 4 years, and they would not take me part-time. So I ended up working full-time with them, and then my business kind of sort of fell onto Saturdays, unfortunately. But I was able to sort of really bring this holistic health model, because the company I was working with was very physical based. I worked with a lot of naturopaths. I worked with dietitians. So it was a huge learning curve, and really me being able to bring all this knowledge together. And then once I finished that, I restarted. I actually got shoulder tapped to go back to my old job in liaison psychiatry at Middlema Hospital. So I actually went back there a couple of years ago and did another 18 months there with a completely different mindset. So I went back to my old job after not being in there for 7 years, I think it was, which was a bit of a shock to the system. But I just had such different knowledge and such a different mindset that I actually really enjoyed being back, because I just came in with a life coaching approach, actually.
Yeah, my question was going to be actually how you felt like your new perspective fit within that medical model that you had left.
It fitted really, really well. I did get in a little bit of trouble sometimes because I knew so much, and I'd been working so much with dietitians and diet and research around that. I would go and see people, and if it was appropriate, not everyone, but I would really focus on, hey, tell me a little bit about what you eat and what's your diet like. And so if I saw, like, I would go and see a young male, and I would go into his room and say he was 18 and he'd had repeated surgeries for a non-healing wound, and the staff had asked us to come in because he wasn't very motivated, and they wondered whether he'd developed depression. And so I was chatting away to him, and I looked at his bloods, and his iron levels were like on the floor because he'd had so many surgeries. And I'm like, well, of course he's tired. And, but I walked into his room and he had a ginormous bucket of KFC on his bedside table. So, and I think a bottle of Coca-Cola or something. So, I did my assessment. I thought, he's not depressed. He's flat. He's struggling with energy. He's sick of being in hospital. All these things that are completely normal. And so I ruled out any serious mental health issues. And I said, look, tell me, what do you want? What's really important to you about getting out of here? And so he voiced that he was a rugby player and he really wanted to get back into his rugby. And so in that sort of life coaching way, I really started to talk about, how that's so important to him and what do you need to be a rugby player. And he could identify he needed to be fit and well. And I said, okay, I just want to talk to you a little bit about what you're eating here, and how this might contribute to you healing and getting out of here. And so he was completely open to this discussion around what, and he got it. I said, we need, if we're going to build muscle, what do you think we need? And if we want to have strength, and people got it. They really did get it. And I said, tell me what your favorite food is. Tell me what if you were going to go home and Mum said, I've cooked you your favorite food, what is it? And he said, raw fish. So marinated fish, which is traditional meal. And I said, fantastic. I said, can you get Mum to bring in some raw fish for a meal for you? And he said, oh, yeah, I'll ask. A couple of days later, I went in, no KFC, no Coca-Cola, a container with homemade food. And I just thought that to me is enough. I mean, I literally only saw him twice because that was all I had to do, and I didn't, need to go back and continue seeing him. But it's those sorts of things that I thought, well, hopefully now he feels a little bit empowered to understand that actually what he puts in his mouth is actually really important as part of his body function. And if he wants to be a good rugby player, this is some of the stuff that he needs to look at. I did get pulled up once after having quite an in-depth discussion with a client about his diet, and he spoke to the medical team that were doing the rounds the following day, and I'd written some things down for him, and I'd suggested some supplements as well, which was, probably a little bit borderline. But I thought, I know that these work. I've seen the research. So I'd suggested some supplements for him, and the medical team sort of said, who suggested that you should get on some omega-3 and whatever else it was I suggested. And they said, oh, the psychiatric nurse. And I was like, oh, because I came to see him and I was outside the curtain, about to step in, and I could hear this conversation going on. So I introduced myself, and they didn't say anything at the time, but I went back to my office and I said to the head psychiatrist, I said, if you get a complaint about me and maybe overstepping some boundaries, I said, it's me talking about nutrition. Anyway, I got a phone call from the consultant saying, is this usual practice for psychiatric nurses too? Anyway, I had a good chat. She was actually lovely. I had a good chat to her. I told her about my background. I said, look, I lecture to the University of Auckland twice a year on nutrition and mental health. I'm not just pulling this out of nowhere. And she heard that, and she said, well, maybe next time just don't write it down. And I thought, oh, man, instead of, wow, this is great. Can you show me the research? Can you share with me the research that you're basing this on? No, it was maybe don't write it down. I was like, oh, man. We've got a long way to go.
Yeah, absolutely. Well, you're driving that change. And, I think that story that you shared about the patient is also just an example of how your approach really does empower individuals within their own healthcare. Because I feel like, you lose a lot of autonomy as a patient within the medical system. You feel like you, as a patient, you're not out of control. Ultimately, you still have say, but when you're surrounded by a bunch of experts who are placing orders and telling you all of these things that need to be done, and really it's often presented as, well, this is what we're going to do. It's not always presented as a choice, so it does feel a bit disempowering to be wrapped up in the medical system as a patient.
I 100% agree. It is incredibly disempowering, I think, because you literally get offered, here's some medication, and I've experienced this, myself with my partner who had some cardiovascular issues. What can we do? Oh, nothing. Here, just take this statins and this medication. So in mental health, I think people are already they're really struggling, obviously, with how they're feeling, and they come to this expert on mental illness, and it is very much, here we go, here's the medication for you to take, we'll send you to a counsellor. But not once are they given this sort of suggestion that actually you can do some things too that would really help you to improve. and now, thank goodness, slowly we're starting to get a more health coaching approach. Yeah, actually, if you just simply got outside and walked for 15 minutes twice a day, research shows that you are likely to have an improvement in your mood. In fact, research shows that they may be as good as these tablets that we're suggesting that you take. And, maybe if you can have a little bit more sort of fruit and vegetables and some fatty fish and some omega-3s in your diet, the research actually shows that this can actually help improve your mood. It's really about encouraging the person to be part of the healing puzzle. And I say that the doctor or the nurse may be the expert in mental illness, but the patient is the expert in themselves. And that really we need to be approaching as equals. We need to be approaching a treatment regime and a treatment plan as equals, not as I'm the expert, this is what we do, you're the patient down here. I just think our whole medical model needs a bit of a shake-up, actually, and really starts to embrace empowering the individual. Now, not all individuals have the capacity, but most individuals have the capacity to think, make some decisions, with some encouragement or some support to do things that are in alignment with, being well or getting better. So, yeah.
I learned very early in my career. Now, I did pediatrics, so, this more so pertains to like the parent versus like the baby. But I learned very early in my career that you don't question a mom, like even if a mom brings a baby in and saying something is not right, something is not right, and everything on your assessment is totally fine, and you're thinking, man, I don't know, like this looks okay, but if that mom is saying something is not right with my baby, you better listen. And so I think that is like, we do need to also just like approach our patient interactions with that open-mindedness that, like that patient is bringing in a really important perspective, which is their own, and it's their health that we're there to address. So yeah, I do think that, as clinicians, we can make it more of a conversation rather than just a like, hey, I'm coming in here and I'm the expert, you came to see me, and this is what we're going to do. And I think that would help patients feel a lot better within our medical system. I know it would make me feel better if I was like given, options, but also just like provided with the space to have a discussion about what those options are. And of course, there's not always time for that, like in a critical situation, like that's the exception here. But yeah, I agree. I think that it's really important to empower individuals in their own healthcare.
And unfortunately, people will just go off and Google anyway now. Now we have Dr. Google, and so people will just go off anyway. But unfortunately, what happens is they end up going down rabbit holes that aren't particularly helpful. And that's one thing I often end up having to bring patients back. And I'm like, or the people I see, the clients I see, I'm like, hang on a minute. I get that you're going down this rabbit hole of whatever superfood or supplement or whatever it might be that they're, going down. But actually, are you doing the basics? There's no point in taking, this latest superfood that's supposed to be amazing for whatever it might be, mental health or whatever healing path they're on. But you're staying up till 2:00 in the morning watching Netflix, and you're sitting on the couch and you're eating crisps, chips. And like, we have to do these basics first, get the basics nailed, then let's look at what else. Because there are lots of other things as well. There are, the way we breathe, it's another one that's really important to add in. How are you breathing? How do we make sure that your breath is actually calm and giving those right signals to the brain that actually everything's okay? And so, community, social support, there's so many other things that we can bring in that are so important as part of a person's healing regime. But yeah, I think if we have a model that is just kind of, here we go, and the person's walking out of there going, I don't even want to take these, we've kind of lost them. We've lost them. They're not going to come back. They're not going to say, I don't want to take your tablets. I'm going to do something myself. But then, unfortunately, like I said, if we're not working with them, there's a chance that they're going to go down a path that really isn't perhaps very helpful for them.
Yeah, absolutely. Well, I think that we've covered a ton of really good stuff. But if there was I don't know, a couple of takeaways that you might want to pass on to nurses who are listening and maybe feeling, a little bit stuck or burnt out in their own career, what is it that you would want to leave them with?
Oh, I just 100% believe that nurses can do anything. Choose your path and make it work for you. There's jobs out there that can't even be imagined in some ways. But if you have a special passion, I would say go for it. And you might not be able to leave your day job immediately, but there's nothing wrong with developing an interest and empowering yourself to take a different direction in your nursing. Highly encourage. What I always say to nurses when I'm sort of giving these lectures is think outside the square. We've been so, this is the square of medicine, and no, we don't have to actually fit inside that. We can do whatever we want. You're a perfect example of that. So think outside the square, and if you have a passion, nurses can do anything. So there's so much potential.
Takeaway.
Yeah.
I could not agree with you more on that. Yeah, I think that nurses have a lot of value to give and a lot of passion. Nurses bring so much passion to their work. So I'm with you. Chase that down and see where it leads.
Yeah, 100%.
If you'd like to connect with Helen after today's show, you can visit her website at onelifenz.com, email her at helen@onelifenz.com, or find her on Instagram at Facebook at onelifenz. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, sign up for my free newsletter at mypivotpath.com. Get non-bedside jobs delivered to your inbox every week. And if you have questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and until next time.